Afternoon, welcome to all of you. Just to give a very brief introduction about myself, I am a librarian by training and I worked in a hospital library, and I also was the first librarian of health when it was in Kemp's Corner. So,
That's nice.
so I had the privilege of organizing a lot of these books right out of cartons and doing that kind of thing. I've seen it shift through 2 locations and whatever that it took. It's been a part of this even after leaving. What I evolved into later, when I joined health, that was the time when internet access came in. And I found that I had a very good flair for searching information of anything electronically. And at that time, it was a feeling of hunch that I could help a lot more people do better with what is being put up on the internet, otherwise people are getting confused. So with that, I went on a journey of seeing how best I could do it. It was a very long, tedious journey, but 6 years back, I set up this QMed Knowledge Foundation. QMed really does not stand for anything specifically, but it symbolically means quality in medical education. Just symbolic. And what we have done in the last 6 years is we've done a lot of workshops for medical students, practicing doctors, teaching doctors, all of them, as to how they should stay up to date by searching for the right updates from the internet correctly, instead of just getting lost out there. So our foundation has made a name for itself through the medical colleges and academic network. And we all the time felt that we need to enhance the non-medical people's approach to using all this as well. But we did wait a bit, start there first, because we felt that if you took something from what you learned here to your doctor should also have some right approach about it. So we felt that we've laid that foundation. Today, if you say that it came from HELP, it came from QMed, there's a better chance for them to appreciate what it is. And I'll tell you a little more again about this at the end, but let me get started with now. So in the beginning, what we would like all of you to share with us and tell us how many of you use the internet to seek health information. Do you do that? Okay, so at least half of you are doing that. And when you do that, would any one person like to tell us where do you go first? What do you put in? Any sample query? How do you go about doing your search? Anyone who uses would like to share with us? You go to Google. So can you share with us a typical query that you're doing?
Prostate.
Okay. So what do you put in and how do you choose what you like in that?
Herbal treatment for prostate.
Okay.
Enlarged prostate.
Okay.
You will come 1, 2, 3, 4.
So you go through as many as you can, and roughly how much time would you spend on doing a query like that?
Depends on how many are listed there of my interest.
Yes. So on an average, 1 or 2 hours, what's the kind of
We
time?
will go about half an hour.
Half
Then
an
again next day, the next day.
Next day and so on. Anybody else, something different? Okay.
Very often there's a lot of negative approach to the whole thing.
Right.
I mean, you need to put your your approach to see that what you're getting is right.
Right.
And very often you can be mishandled.
Absolutely. That's right. What is interesting is this is more or less the same answer I get from the professionals also. Doctors, students, postgraduate students, anybody at all to get more or less.
Many
Yes,
times there is a misinformation.
yes.
What is stated may not be true. It may be the other way around. And amounts to misleading the seeker.
Yes, there could be a lot of misleading information also. So we'll talk a little about all these things as we go. So today, my talk will be broadly in 4 parts. So a little about the background of whatever we just discussed, and then I'm going to tell you how you can divide any information resource into one of 3 types. It's a very broad thing and it's very easy when you know that as to how you would search. And I'll give you some examples of some important resources. We even have a small handout with that list, so you don't really have to write down all those resources. And a couple of simple tips on searching, which is really foundational, because searching is a very complex art. We do 1 day, 2 day workshops on it for professionals. It's a very complex thing. But if we just tell you 1 or 2 things, that itself can make a difference if you go back today, and you'll get an idea as to why it is important to do all that right and not waste time on that. So first part, the background, where let's talk a little about the context as to when we search, why we search. The importance of finding the right kind, because you just mentioned you do find misleading information as well. And when you search, what can go right and wrong? We just have a brief background about all this. So, when and where do we need health information? We have health-related queries, good health. Like, are bananas good for our health? There's always a controversy about something like this. Then, we have condition. These are not diseases, they are conditions. Pregnancy, about bringing up children, posture, obesity, or being very thin. They are not diseases, but they are health conditions. We need something like this. And then actual diseases, hypertension, cancer, so many of them that somebody we know is afflicted with. We've heard about it, we know a lot, and yet there's a lot we don't know. That's when 100 questions come up in. So when we are faced with the need for information, what are our needs? First, we need to understand. Let's say even something like diabetes. Today we all know it, but till today, if nobody in the family has it, and somebody has been diagnosed, we say, okay, we know that it's high blood sugar, but what can go wrong? What should we do? What should we not do? We have 100 questions, and doctors may tell us a whole lot of things. Sometimes they may forget simply because they know it so well. They assume, that's something you do know. It hasn't struck them that you may not know. It's not really a fault or a mistake, but there are 100 things we ought to know. They might tell you 80, 90 and forget something else. Sometimes we want to find the right physiotherapist or the right doctor or something like that. We are not covering that part because we're not doing advocacy for anybody. We're talking more about how do you find such things. The right hospital, something like that. Then, based on all this, we want to make right decisions. So today's talk is really an overview of all this. Then we'll tell you how, if you want to learn more, what to do. So before we actually start searching, what is it that we need to know about information resources? Whatever we are going to search, find, read up, the most important thing is the authenticity. Because when it is a book, it's very expensive to publish a book. So nobody will simply put anything and publish it because it's going to take that much of money to do it and then to sell it. Whereas on the internet, it's so easy to put up anything at all. So who is responsible for that resource or website? It's a very, very important issue. Like when you said misleading information, a lot of people write blogs, which is just their own opinions. It may have worked, something may have worked for them, but may not be the thing which is going to work for everybody. So whether to call it misleading or not, let's leave that aside, but we are not sure about it.
I mean, almost 50 to 60% is misleading actually.
Workable or not workable.
That's right. Second thing is the recency of the site. If you're finding a website which is 10 years old, when I say 10 years old, not the site could have been there for 10 years, but if they haven't updated stuff for the last 10 years, then it's definitely not a site you should go to. Because even books, let's say a medical book, we always look for which is the most recent edition because we want to know what is latest. So a website definitely should keep saying checked for authenticity or whatever, some kind of indication like this. Then the purpose. Medical information can be put up by companies which are making profits, and they could put with a purpose to sell. It doesn't mean that their information is necessarily bad or wrong, but you have to be prepared with your antennae up that how much of it do we believe, do we need to verify it elsewhere. And the organization of the site. Can you find the information easily on it? or is it all buried somewhere, there's no way you get it. Of course, this is not a reason to reject a site outright, but if you have a site which is better organized, easy to find, you would rather go for that. And we'll just show you a small example of this. I have put a link here which I'll show you how to find it. You don't need to write down that big long thing. And I'll tell you, I would strongly recommend go through that small video. It's really a video from which I've just taken a couple of clips and put this. In this site, what they tell you is that you want a trusted resource, etc. They're showing two examples. One is Institute for a Healthier Heart. Another is Physicians Academy for Better Health. Now both these are fake sites. They've just put these as examples. And they want to tell you, now by the name, both of them sound very authentic and good. But what you should be careful about. So if you go into the site, the best place to find out anything about a website is the About Us section, how much they tell. So if you go to the About Us section, the Physicians Academy for Better Health says, this website has been created by doctors and cardiologists. The mission of our site is to educate the public. That's why we made this site. And there are contact details, a physical address, phone number, etc. Whereas the Institute for Healthier Heart, if you go to the About Us, it says this website has been created by a select group of individuals and businesses concerned with health. No names, no qualifications, nothing. If you go into the video, they'll show you. And apart from that, the site is supported by a company that produces medications, and they've given a link to buy it as well. Again, it does not mean that everything there is fake or whatever, but you've got to look a little carefully, and that comes with a little more experience and understanding that. The contact details, there's no physical address, there's only a webmaster, which is very dangerous. Suppose you buy something and it kills somebody in the house. Tomorrow they can take down the website, and then you have no way you're going to be tracing it out. So it's very important that you know where they are located. There's a phone number to call, speak to somebody. Small things like these. So this video explains all this in good detail. I've just taken a small bit and shown you this. And later I'll tell you where you can find this. So when you're searching, let's take our question. Are bananas good for health or bad? This is a thing. Very often, so let's say you have specific questions like this. We always read in the newspaper, research showed that, or study shows this. And we just immediately tend to think, wow, somebody's done big research and we've got to accept. But I did a Google search where everywhere it says research shows something. Let's take one page of search results. So this one says, don't hate on bananas, pretty fit. But if you see the URL, that is a website address, it says beprettyfit.wordpress.com. Anything like this is usually somebody's blog. So it's an opinion of somebody. It may be right, it may not be right. And here it says, research shows that bananas contain certain dietary fiber, etc., etc. Another one, again, we don't know what this site is about, examiner.com something. Research shows that bananas may be a better choice, something. One more here, it says something like that, they contain certain enzymes which do whatever. On the same result page, we have two which talk negatively about bananas. So we are always really stuck as to which is going to be authentic here. Google is what everybody starts with, but Google searches the entire world. See, Google is brilliant. This is not an anti-Google thing that I'm saying. But we've got to understand what it can do, what it can't do. And if it is, its power is that it searches anywhere, and if you've lost something, you know where to find it. But when it gives you these huge number of results, it's just searched everything that somebody or the other in the world has put up. So you get blogs, you get a whole lot of things, and you're stuck with things like that. So we are stuck with the problem of which one to believe, how many pages of results do we go through. As this gentleman said, half an hour every day, how many days, end of 1 week, do you remember what you had on the first day? Is that site still there or not? A whole lot of things that can happen. The point is, for using the internet resources, there are certain right methods to go about. So let's have an overview about all this. So what we will do, and what overall that needs to be done is, you've got to learn about resources, how to search correctly, or librarians or information specialists have better training on how to search. So ask their help, always helps. And once you get the research results, how do you understand them, at least broadly, to talk to doctors or any health providers? In the end, we all know that there are limitations in research, limitations in what a doctor can do. They do wonders a lot of times, but there are times when they can't. It is finally there's a God or a nature which is up there, which is dictating how long we live, how long, whether we get better, etc. So that much was the prelude. The part 2 of the lecture is the types of information resources. So if we learn to categorize them, then we know where to go for our question. And here I'll show you a very simple classification which, again, as I said, even the doctors, students, everybody appreciates. There are many ways you can, but this is a very simple method. If we talk of 3 main categories. One is on any, say, disease or condition or anything, there are background and factual information resources. This library is filled with some excellent such set of resources. You want something on diabetes, there are shelves of them. You want only pamphlets to read first, that's there. You want big books, they're there. From simple to complex, understanding a disease or a condition thoroughly, whatever you know, don't know, that is there. Factual information is what you see in, say, a dictionary or a drug resource. You've been prescribed a drug, you want to read that, know more about it. All that is there in the factual resources. Then you have certain resources today which I'll enlighten you with, where they have studied all the large research papers on a topic and compiled them together. And when they compile all the result studies together, you get to know whether something works or it doesn't work, or we don't have a clear answer yet. I'll just show you a couple of such resources. And the third, which is the bulk, is all the research studies that are done. Most often they're published in medical journals. So it could be something like, we observed some change in dengue this year. So many doctors will write, yes, I also saw it in my patient, etc. That comes as journal articles. Sometimes it is a new drug that has come in, so they've done a study on 200 patients who got the drug, 200 patients who got the old drug, what were the comparisons. So those are all studies which are reported in journal articles. And it is from these studies, large studies, that result compilation, the second type that I said, are made. So I'll give you examples of these. Now any website that you go to can be a single type. It could be just a medical journal. That is one of the third types. It could be just a textbook, which would be the first type. And sometimes it could be combination. A website can have 40 textbooks, 50 journals, as well as those reports of compiled research. So whenever you go to a website today, start looking at, is it one of the types alone or a combination of more than either 2 or 3 together. So we'll move on to part 3, examples of such resources. For the background information, as I said, in print we have so many books, say in this library. Medical textbooks are also similar, but when we are non-medicos, we prefer these kind of books. If you go to go for a website, the best one today I would recommend is medlineplus.gov, www. In the handout we are giving you all these lists. This one has been put up by the National Library of Medicine in the US.
National
Library of Medicine. It's a big, huge library in Washington, D.C. What they've done is, so you've heard of big organizations like Mayo Clinic and a lot of places like that. So the information they put up, they've given links to each of those. I'll just show you a sample page. So they keep on scouting for the best resources, and they have a methodology of doing all this. So the entire thing is maintained and constantly updated. So this is how the page will come up, medlineplus.gov. What I'm going to show you first is how this site is one of the best examples for what I talked about, authenticity, organization, etc. Let's take a look. So first thing is, okay, before I go to that, if you come to this medlineplus.gov, there is this videos and pool tools. If you click on that, a list of videos will come that evaluating health information will be here. The video that I talked about as to how you figure out which is a good site or not. Please go through that. It's very, very useful. Very short, hardly about 10 minutes or so. So that's good to go. Now, this is put up by the National Library of Medicines, which itself is one of the National Institutes of Health, which is a huge number of institutions together, one of their institutions. So automatically, the authenticity and purpose is very clear. It's a government entity, US government, and their purpose is to educate. Then, suppose broadly they have three sections: health topics, drugs, videos. If we take health topics, it is put up in different ways, either by body location or by disorders, conditions, demographic groups. So you have so many of these. Health topics is through any of these, or you also have alphabetically. So if you want something on diabetes, you could go to D, or you could go to endocrine system if you know that from body location, or here you have diabetes as diseases. Whichever way you are comfortable with, it's straight, makes it easy for different people, think differently, all that gets addressed. So ease of organization is straight there on the home page itself. Then, suppose we chose diabetes. We are in diabetes type 2. So here, if you scroll down the page, they've made further subdivisions like basic information, research information, there's a learn more, again multimedia pool tools, tutorials on diabetes. They've organized it as clearly as that. Further down, if we take that overviews from the basics, they've told you right here from where. The first one is from a resource called Up to Date, which is a very well-known resource. The second one says IntelliHealth, Harvard Medical School. The third one says Mayo Foundation. All well-known resources. Right here, authenticity from where everything is very clearly defined. How often is Medline Plus updated? They tell you something is updated every day, something is, okay, my slide is old, so it says copyright 2012, but otherwise it will be 2013. Something is updated monthly, something is updated every week. They very clearly told you how often each section is updated. So Medline Plus is a very great starting point. As I said, do go through that video section and evaluating and browse for any disease you want. From basics to research to results of research, everything is there. Though I said it's for the first type background, it really covers all, but the background is covered extremely well. It's very easy to use this resource. So let's go to the websites for results of research. There is a lot of research has been done in different places, and all that has been, the results of any research topic have been combined to tell you whether something works or doesn't. So there are two well-known sites for this. There will be more than that, but two free sites that I'm talking about. One is Cochrane Summaries and one is PubMed Health. I'll give you a brief overview of these two. So Cochrane Summaries, the URL, the website is summaries.cochrane.org. Again, in our handout, we have it all written there. So this is how it looks, very simple. Suppose we do a search on epidural analgesia in labor. Somebody wants to make, a woman wants to decide whether she wants epidural analgesia during labor for ease of pain. Then there are 12 search results here. The very first one, it says not enough evidence to suggest that stopping an epidural something. Very clearly they start with, we still don't know yet. If you click that link, it begins with that. In the end, it also says more research is needed. See, today this is a very common topic which young pregnant women want to know more about. Should we go through all that pain or can we have this? The thing is, of course, this is not exactly about, this is something about adverse delivery outcomes. But they want to know, will there be anything adverse or not? So these results are there. What decision do you take? You read this, ask your questions to the doctor rather than reading just what a friend has written about an experience. That's the idea of this. It says abstract, click to read. If you click that, you get the medical abstract, the short form of the entire review. What is put up here is for people like us to understand. If you click abstract, you get the medical language there. This depends on if you have a doctor you could discuss it with, that's one thing. And the most important is the full review. Full review can be something like 20 pages long. But a doctor who's trained to read it will be able to read it and say, does this apply to you also? What is interesting in our country is this entire site, though it's not a free site, it's a paid site, the Indian Council of Medical Research has made it free for the whole country because they have paid the publisher a fee for the whole country to access. The sad part is many people are still not aware, I mean even in the medical community. So we are constantly telling them that it's important to read this because this is where you get the best evidence of what the status of research is today.
They are paid for both Cochrane and PubMed.
PubMed is free. That is, this Cochrane is what they have paid for. So every such topic is managed by a group. In this case, it is pregnancy and childbirth group. Sometimes it's a broad thing like this. Sometimes it is as specific as schizophrenia group. One disease has a group. So let's look at something like that. So in this case, the review is managed by the pregnancy and childbirth group. There are experts from within that, different angles, who are a group who dictate how the review has to be written in a very systematic way. They should have, whoever does that review should have searched all across the world in a very specific manner, found all the large studies, how do they do the analysis of all that. Everything is very, very clearly defined. There is also something called a consumer network, which is a very interesting thing. People like all of us, we get trained in understanding this and writing those small summaries and being very specific about what kind of information should be included. I have attended one of those groups where people have said, you know, we have to say that if a drug has shown any adverse effect, it has to be put down in the summary so that patients are better educated.
Just repeat it again and try to analyze much more what you last said is very important.
Yeah, so what happens is any such review, what we saw just now, they're all called systematic reviews. Any such review is written by, you know, 2 or 3 people. But all the time while they are doing it, they are governed by experts who know that system. Because these are not like, say, a standard magazine article that you can write the way you want. It has to be written in a particular structure. And this, what is called the summary, Cochrane summary, which is for people like us to be able to read and understand. So there is, apart from those experts, there are people who are part of this consumer network. They also get trained from a consumer viewpoint, layperson viewpoint, and they are invited to read up the review, read up the summary, and say that, you know, in this review there was some adverse effect of a drug mentioned that has to be what should form the content so that patients are well informed. That's how strong that consumer network is, apart from the subject
Who
expert.
trains up the consumers?
As far as I know, it is, you know, this Cochrane network is a worldwide network. So it's done by different people across the world, uh, which is a mix of doctors as well as non-doctors, scientific people, or even people who are just interested. Like I've gone and attended certain workshops, I've learned a certain amount. There's a lot more I need to, but that way. So I don't have a very perfect answer as to who trains the consumers and all that, but there is
Are they approved by the various medical councils?
very much, very much. I mean, in fact, they don't have to be, because this is something which is a network which is on a voluntary basis, people come and do this entire thing, and they have, like a society, they formed the rules, formed the guidelines, which is about 20 years old now, just got better and better with every year. So this is a website for the consumer network itself. So it will be good to go in here and we can learn a lot more as to how it operates. This is the other resource, PubMed Health. This is again by the National Library of Medicine in the US. Here what is very important learning for us is, there is this last tab which has something about understanding research results, understanding what is clinical effectiveness. So you read up that, it guides you as to how you can read up any research results and understand them. And there's also this overall contents, what kind of medical information contents they have. They have a whole lot of topics for health consumers. They have things like those executive summaries, medical encyclopedia. So that's encyclopedia is like a type 1 resource. The executive summaries and their reviews are the type 2, that is results of research. And yeah, I think that's it. There's no basic research out here, but these two kinds. And this first, understanding the effectiveness, guides you as to how you read such resources and understand.
This is not clear, understanding clinical effectiveness.
This thing is,
I mean, what actually it means literally, meaning of it.
so clinical effectiveness is, let's say a treatment has been prescribed. We read somewhere it has been effective for some people, it's not been effective. So what do we mean by clinically effective is all kind of explained in those resources. The last bit is about some foundational tips for searching. I'm being very, very basic here. As I said, we normally conduct full workshops on how to do that, which is a little complex, but with practice it comes. Just to give an overview. So this PubMed, which I mentioned, which is different from PubMed Health. PubMed has about today it's about 22 million journal articles, or a little more. 4,800 medical journals worldwide. Some of them going back to the 1940s, the newer ones are as new as they can be. The contents of all of them form a database here. Just to give you, and you will not get the full article here because the full articles are in the journal's website. Just to give you an example, I'm sure people in this room would have all seen those printed telephone directories when we had MTNLs. So what did we have there? Name, address, phone number. But the individual people were living in their own houses. Through that, you got their address, phone number, you had to go to their house to see them, right? So that way, here you get to know what is published on a topic in a journal, but you have to go to the website of the journal for reading the full article. What PubMed does is, from that basic information, it will give a link to that page in the journal. Now, whether that journal is free or not is decided by the journal publisher. If it is free in PubMed, they mention it is free. That's all they are allowed to do, because their scope starts with that. So when we search this, because it has got 22 million or 23 million today, almost any word you put in, you will get huge number of results. Let's take some example here. I have typed in treatment of asthma in children. This is typically how anybody, we all asked in the beginning, how do you do a Google search? This is what the average doctor or medical student also does in PubMed. They know that they'll get only journal articles, but they all have worked on the principle that this is the only way they can search. What did we get as results? 22,786 articles. Are they going to be able to read that many? No way. Now the point is, the first principle in searching is for people to understand, when you put in a query like this and search, it is going to find search results which contain those words. Whether it is about it or not, no guarantee. Let's take the very first result, and today I did the search today so that it's the latest. You could even go back home and try. The first one says overview of alopecia areata.
Can you zoom the PPT a little?
No.
On the laptop.
On the laptop, no. The PPT can't. Only the web pages can be zoomed.
We can zoom the PPT, no? The 100%, 80% that we do.
The word children, asthma, treatment, all are there. So in that 22,000 whatever, there's no way we get to know how many of them are going to be about treatment of asthma in children and how many are not.
Bottom
Okay,
right,
I'm
plus
reading
minus
it out.
may be there.
Sorry.
Bottom right, plus minus may be there. Bottom
That's what
right.
I'm doing. Plus, minus.
No, but I don't think it works for this.
No, I'm saying if we go out of the slide.
I've put in now, I'll read it out and explain what it is. I'll put treatment in square brackets, TI, which is short form for title, and asthma, TI, and child, TI, or children, TI. Which means I want the words asthma, the word treatment, and either child or children in the title of every article that I get. So that 22,000 something is come to 640. All of them you can see, asthma treatment, children, treatment, asthma, children, treatment, child, asthma. It's all there, and the titles are very explanatory that they are about. This of course is not the best method of searching. It's who's written the title of the article, it's the author who's written it. Sometimes they may write a fancy title which is not having these words, and then how do we find out? We train people how to do all this. But if you want a quick reading list on this, this becomes a very easy way to search rather than going through in that 22,000 how many of them have other things. The best way we would train them is this. It's not easy to understand now, but I'll explain. I put there asthma / drug therapy, major, no EXP, it sounds like Greek and Latin, I know, and randomized controlled trial, PT, and child, I put in MH. I'll just explain what these are. Whatever we put in those square brackets are saying we want those words only if they appear there. For example, if I go back to the telephone directory, suppose the telephone directory were on the computer today, and if I say I want Jones only if it is in the address, I don't want it as somebody's name. Computer allows you to do such things. So similar, each of these has a standard structure, just like the telephone directory has name, address, phone number. So every record has that. So here we are saying this asthma drug therapy means drug therapy for asthma. It's a standard phrase for treatment of asthma. We've got to go in and figure out how to, we train, how do you do this? It's, as I said, takes some time, but it's not really difficult to understand. Where do you go to find the right term? So asthma, drug therapy. Major means we want the major focus of the article to be on that. No EXP has something about more specific types of asthma we don't want. That is, there's a term called status asthmaticus, similar specific types of asthma. We don't want those, we want a broader asthma. And it has to be a randomized controlled trial, that is a study where one lot of patients have been given one medication, another has not been given or has been given something else, and it should be a children-based study. So, and when we say and everywhere, all these conditions are compulsory. That's what we say. So these are search principles by which you do a search. And we've got something much less than the 22,000, but we've got a much holistic coverage compared to the 600 and odd that we got earlier. what we actually teach is, as I said, the first thing. If you just do words, you're getting the presence of the word. We took the alopecia areata example, where we searched for treatment of asthma in children. Those 3 words were there, but it was about baldness. Field searches, where do you want your field, your word to be in the title as a topic, that major, mesh, all that were topics. The combinations, we saw and everywhere. And means you want all your terms to be there. Or means if you say asthma or allergy, whatever results could have either asthma or allergy or both. Not means you're excluding something. And how do you understand all these in more depth? This is a very broad coverage. I've just put a screenshot of Google Advanced Search. Today, where will you find it? If you go to Google, on the bottom right, you have something called settings. They change the location every now and then, I don't know why, but we checked it out today. So on the bottom right, you have something called settings. If you click that, you get an option of advanced search. And if you click advanced search, you get a screen like this. So here, it says, find pages with all these words. So if you put in asthma, allergy, something here, it means I want pages where all these words are present. So which is like that and combination, asthma and allergy and whatever. The next thing says this exact word or phrase. So you could put diabetes mellitus or diabetic retinopathy, something like that. Any of these words, which is the or, asthma or allergy. That principle, in PubMed you use that or, here you put it in words like this. Then you have other things, narrow your search by language, any language, all these are advanced options. So whatever you're putting, you're saying, I want all these compulsory to be part of my search things. Then, items appearing. Here it says, the terms appearing anywhere in the page. You have an option of in the title of the page somewhere. So that is where it appears, which was the field search in PubMed. So these principles are really constant across most. The number of such options to search may vary from site to site, but the principles are the same. So the take-home message on all this is, searching is a structured art and science. It's not simply putting in something and going through pages of results. You have to know where to go. A very simple example I always tell people is, suppose you have a Mumbai telephone directory and you have your office telephone directory. If you want to find your office colleague's number, why go to the Mumbai directory? The office directory is a quicker resource, that kind of thing. Authentic resources which are updated regularly, search correctly, and evidence of treatment may or may not exist. And best is to take your decision with your doctor based on best available evidence. See, some of the examples that doctors have shared when we have talked like this is, we all have heard about laparoscopic surgery, which is very small incision and how good it is. So there's a laparoscopic surgeon who specifically shows students that he shows one of those results of research paper, a Cochrane systematic review, where they have studied something like 20 or more different studies done, and it finally shows that there's really no difference between laparoscopic and traditional surgery in terms of risks or better outcomes. The only thing where a laparoscopic surgery is slightly better is the length of stay in the hospital. So what he says is, if patients come to me and say, no, I want laparoscopic surgery only, I still tell them, both options are there, the other surgery may be cheaper. And they say, no, I want only this because, my mama said this, my somebody said this. So fine, do it and do it, On his side, he's done this. So this is where it's, what is important, now length of stay, if it matters to you a lot, great, laparoscopic. But in that you also get to know what other discomforts you could go through. And in the end, all that evidence, what doctors are trained into when they learn this evidence-based treatment is, whatever the evidence is, finally for your individual patient, there could be variations, discuss it with them and then do it. Another classic story I've heard is in CMC Vellore. They treat a lot of very poor patients. So there was this vegetable seller who had some heart problem, and they told her that, surgery is important in your case, but she said, sorry, I can't afford my livelihood thing. They gave her details about how if you don't undergo surgery, you'll take a little longer to recover. She said, that's all right, but surgery means I'm confined to home, it's so long, I would rather take it a little easier every day and do things like that. So they've actually explained available evidence to her and helped her take a decision. It is possible to do such things.
CMC, Vellore, Christian Mission Hospital.
Christian Medical College, Vellore. So, I'll tell you a little bit about us again, and then we can have some discussions. So, as I said, we've done, more than 100, 120, 140 such short lectures, as well as half-day, full-day workshops for medical students, doctors, nurses, physiotherapy, etc., all over the country. And we want to now start doing this for consumers. I've given you a very, very broad overview. We'd really love to have your opinion as to whether you found this interesting. I don't know how useful it could be with such minimal knowledge, but even just the awareness that there is something more to do, something more to learn would be important. Who are the people involved here? My colleague Lakshmi is sitting behind. She has a research background. I have a couple more colleagues who are librarians and who got trained into this. So we are a group doing this. Two of our trustees are doctors. Some real life stories based on this kind of search experience. This is not from QMed. Let's say in the first case, as I mentioned, I was the first librarian here. At that time, a doctor phoned me up and he said, I have a newborn son who's got a rare condition, and that was called this agenesis of corpus callosum. And he said, I don't want any medical information on this, I have enough of that, but I want to know socially what I'm going to do with this. Now what that is absence of some tissue portion of the brain, and that has its implications. So at that time, internet itself was new and it didn't have so many features that we have today. Still, I did a search and gave him a whole lot of things. Many years later, on a mailing list, he got to hear something about me and he wrote, giving me this. Your information helped me a lot. Taking the cue, I went to Boston to meet someone who ran an NGO. I still receive a newsletter. And he says, my son works at this place today, which was a big surprise for me. I didn't know enough about the disease. I thought he's going to be, someone who's got to be taken care of, but he's actually employed and working today. So that kind of a thing. Another one was a family friend, my husband's colleague, who was a technical person, technology person. He came home once and he saw, how I do the searching PubMed, and he got very interested, learned about it. Later, he developed a very rare condition, and something about where he would have headaches during the day and he could go out only in the evenings and a whole lot of funny things. The doctor was also struggling a little. He did searches, he took my help, did all that. And after a while, my husband also quit the job, so we didn't really follow up. But much later, just about a few months back, we called him to ask how he's doing. And then he sent me this email, which was a big surprise to me again. Entire credit is to you, which I came to know about PubMed. I searched and all this. He got completely cured out of it. So this is not, my search alone. It is how he took it, how he did more, how he went to the doctor, discussed it, and they did something more about it. This is our website, qmed.org.in. I'd like sharing this picture where this year, in the month of May, I got this international award, which is called an award for a librarian who's working at getting evidence into practice. Because they instituted this, people applied from all over, and I told them about how we've done so many for doctors and students and how we plan to do it for consumers. So thank you. So what I really like about sharing this is that the importance is recognized and we need to do a lot more. We ourselves alone can't do it alone because we need the inputs, you know, where people struggle, what are the kinds of things they need. We've got to fine tune it to people's needs and how they would like to learn this kind of thing. So how we can help you is what we think of today, but we always welcome ideas. We're going to give out that fact sheet, as I said, which has that list of resources, etc. And when you have, like I gave you those two examples of how people took my help to search. So if people have specific needs, say it could be topics like this, this was something I myself faced when my mother had cancer, and we want to do consulting sessions to help you. We would search those evidence resources, the published literature, something like this, and how maybe even your doctor can talk to us, he or she could refine it a little and say, get me these angles, that kind of thing. And the medical advice part is what the doctor will give. The decision you take with the help of such information and with the help of doctor's guidance. That's what we have in mind because we think that's the way it can go ahead. We are a not-for-profit trust and we don't have any government or agency funding. So right now we crowdsource funds, that is, we just tell people, you know, any time of the year, anytime you're welcome to donate. We have a US portal where we are registering with an Indian one. So people are very often just hearing about, I put up some sort of updates in Facebook and people say, can I donate? So we actually have been raising funds like that. And we ask for donations for any of the professional help. So whether it's a student asking for a help with thesis or a doctor for writing, we say that we'd like a donation of so much. Of course, if it's a student who can't afford, we say, okay, we will waive it. We're working in these models. So anybody who needs that kind of help, we usually say for a literature search and further discussion, we'd like a donation of at least 500 rupees. We are open to the fact that somebody who can't pay can't, but anybody who believes this is important and can give a larger donation, you're always happy with that. And through our website, everybody knows how much we are here. So this is what we are hoping to achieve in the long term. We're really making a start with the consumer thing. We want to do this kind of lectures more often. One of the ideas we have is, can we take a specific disease and just cover that for that day? So those who are interested in, say, hypertension or diabetes or something more specific, one of the cancers, we could go through those kinds of things and make this a better event. So that's how much it is from me. Thank you.
Thank you.
And any discussion or questions, I welcome comments. Anything by which we can improve, I'd be very
Where can you be contacted?
We are based in Andheri.